Hi there, it's the terrible twins again. Little update on the project. Dan's been doing Trojan work and you guys have been doing Trojan work as well. So we want to first of all provide you with the info on the needs assessment. Dan?
Okay guys, thank you first off for filling it out. About 73% of the staff filled it out, which is great because we know you guys are really busy. So just quick couple highlights here. So a lot of you want some information on addiction pathology, as well as disease causation and epidemiology. You guys also wanted to hear about smoking in regards to surgical patients, so we'll provide you with some information on that. The other key highlight was on pharmacotherapy, so NRT, so we'll talk to you guys about that as well. A few of the other things that we will address to kind of boost your guys' confidence. We'll provide you with some information to help you guys be confident when you're addressing smoking cessation with patients, okay? So maybe we'll start with addiction pathology.
Okay, addiction pathology. Tobacco addiction is really the result of the phenomenal efficacy of the lungs in absorbing nicotine. If one spreads out the lung on the floor, it would be the size of a tennis court. So in consequence, when one inhales the smoke from a cigarette, which contains nicotine, it is very rapidly absorbed across the lung and enters into the brain within 3 puffs. Every receptor, nicotine receptor in the brain is saturated. When we saturate our nicotine receptors, we release dopamine, which is a pleasure chemical, and in consequence, we get a very rapid effect of the nicotine when we smoke tobacco in the form of cigarettes. Before, when tobacco was predominantly used by sniffing and chewing, the absorption rate of the nicotine was much slower and the chances of addiction were much reduced. So it's a really difficult thing to quit cigarettes because smoking cigarettes is a remarkably efficient way of getting nicotine, which in consequence releases dopamine. And that is an additive consequence and is very easy to become addicted to that process.
Sure. So maybe some information on the surgical patient as it's related to smoking.
So the surgical patient, if they quit smoking 6 to 8 weeks before surgery, there is a beneficial effect on their lung function, their cardiovascular function, and obviously their ability to transport oxygen, because the average smoker is carrying about 10% of their hemoglobin occupied with carbon monoxide. All of those things are beneficial, of course, but in our situation, we're asking you to help smokers after surgery. And you might say, well, this is going to have no impact on their surgery. In reality, what you are doing is treating nicotine withdrawal. We're not asking you to start treating nicotine addiction per se. We want you to manage these patients' addiction in hospital by giving them the opportunity to have an alternate source of nicotine. We hope, obviously, that if their nicotine addiction is well managed medically without the use of tobacco, that they would consider quitting subsequent to their discharge from hospital. So if you imagine this, you've been smoking for 40 years, you go in and have an operation, the nurse and the doctors treat your nicotine addiction really well, so that you don't need to smoke a cigarette for 2 or 3 days. That would probably give you tremendous confidence to go out there and try to quit. So remember, we're not asking you to get the patients to quit at this stage. We're just asking you, do they want their nicotine addiction managed medically?
That's right. That's very good. And I think, too, a big thing that Dr. Finnegan hit on is the withdrawal, right? So we're actually helping these patients because these withdrawal symptoms are quite nasty, and there's 7 different nicotine withdrawal symptoms that they talk about. So it's your restlessness, the depressed mood, irritability, insomnia, increased appetite. What else am I missing here, Barry?
I think you've hit most
Pretty
of
good.
it.
These nasty, nasty symptoms that come with when you don't get your nicotine. So by offering patients nicotine replacement therapy, you're actually helping these patients, okay? Now the withdrawal symptoms, patients typically experience these about 2 hours after their last nicotine dose. They peak within 24 to 48 hours and can last up to 2 to 4 weeks. Okay, guys?
So it's not too surprising that all those patients are outside the hospital at -20.
That's right.
Because, man, it's a very powerful effect that nicotine has. And we interviewed a few of those patients. And, you know, some of them have got locked out outside. It's a very bad situation, which is why we're going to try and do something about it and manage it a little better, especially as we come into winter. Now, is there a problem with the patch? Is there a problem with the spray? Are there bad side effects? Well, it's a drug, right? So nicotine is a drug. When you spray it in somebody's mouth, in their tongue or in their cheek, it doesn't taste very nice. So when you give that to the patient, you say, look, this doesn't taste very nice. You might as well know that, but it should help you very much with your craving for tobacco. Sometimes if you have a lot of nicotine, it can be difficult to sleep. You can get a skin rash from the patch, and some of the patients may say, look, I tried that before, I got a rash. That's fine. You say, we're not going to give you that. Maybe we'll give you the spray. Maybe you can try that out. So the whole thing is to be very relaxed about it, not coercive, but just to say, we want to give you a hand. It's perfectly fine if you feel you can manage without it. But you may find that if you take it, you might have a use for it. And we have one right here that we can give you, the spray or the patch.
That's very good. Should we chat about the process, do you think?
Sure.
Okay, guys. So the process is going to be pretty straightforward. It's going to be pretty simple, okay? So our patients are going to come into the recovery room as they do, okay? Once it's appropriate, we'll ask the patients if they are smokers, as we were doing earlier on in the month of September, okay? If our patients do identify that they are a smoker, we're just going to ask them if they would like nicotine replacement therapy to help manage withdrawal symptoms, which they might feel while they're in the hospital, because it is a tobacco-free environment. And so often our patients, because they're not getting the regular amount of nicotine that they're used to, will be experiencing some form of withdrawal, okay? So that's how we'll approach it. We'll ask them if they would like help managing their withdrawal symptoms while they're in the hospital, okay? We can then discuss within the two different forms of NRT that will be available in the recovery room. As we mentioned, it is the spray and the patch, okay? If patients are interested, we will obtain a verbal order from anesthesia. Anesthesia will be aware that we're doing this.
Yeah, I've already given them a lecture on tobacco management, and the staff are very positive and very much behind it. And we're going to talk to all the residents about it too. Jeff Bryn is working with me on this.
That's correct.
And they will be aware and cooperative with respect to your requests.
As far as the order forms go, they're pretty straightforward to fill out. There's a little algorithm on the side based on the product that the patient wishes to use. We just have to address how much they're smoking per day. And again, there's a little algorithm that we can follow. Based on the amount they're smoking per day, we'll just choose the dosage that's most appropriate for the patient. We'll then sign the orders as a verbal order. Then we could obtain from Pyxis in recovery the two different products that we're going to use, okay? And that's basically it. We'll leave the orders on the chart. When we're giving a report to the ward staff, we'll just advise them that they have signed up for the nicotine replacement therapy. Okay, simple as that.
Final word, thank you so much for doing this. I think it's really exciting. I hope we'll be able to help a lot of people, and we can only help them with your help and encouragement. So thanks very much again for assisting both of us on this initiative.
Thanks, guys.